It's all over to you now, Dr. Kitty.
Great. So, good evening, good day, everybody. It is my pleasure to and to share space with you. I see some familiar faces. Some of you I have touched personally, and it's just heartwarming to see. You said you're in the land of the living, but we all are. And just to see the progress and to see the passion and to see the just the drive. So for those who I have not had the pleasure of meeting yet, my name is Dr. Kitiboni Adderley. I'm a physical therapist of 20 years. I can't believe it. I graduated July 2000 from the School of Physical Therapy at the University of West Indies in Jamaica. And I have been a physical therapist in the Bahamas for those 20 years, happily serving my country. My road to becoming what I consider myself as a breast oncology specialist began when I was a young therapist in the private hospital here. So my first 4 years, I was a private physical therapist. And in the hospital that had swelling of their arms, of their legs, of their abdomens. And for some reason, it just didn't respond to what I was taught in physical therapy school. So I felt very inadequate and I felt very frustrated because I felt I couldn't help these people, and that was my role. My role as a physical therapist is to improve the function and to improve the quality of life of everybody who I meet. And even if it's by 2%, I need to do something different. So you can imagine my frustration when I meet these patients that were trying to do whatever they could do to remain as functional as possible, and they had a swollen arm or a swollen leg holding them back. And I just felt like I needed to understand this a little bit more. I was even more frustrated when I walked around and I talked to my colleagues, my physicians, my nursing colleagues, and I said, "What is this?" And they said, "Oh, that's something you just get after cancer treatment." And I'm like, "What? Like that's not a diagnosis. That's not an explanation." But if anybody has been following lymphedema and the study of lymphedema, which is the abnormal accumulation of fluid in the body, you would understand that lymphedema studies have grown in leaps and bounds in the last 15 years. So it was ignorance, but not ignorance because of I just didn't bother, maybe a little, but it was ignorance because the field was not being studied as much as it should have been in this segment of the world. Now, to understand that a little better, cancer treatment and management was not where it is now. We have extended quality of life and quantity of life because the treatments have gotten so much better. So now we have survivors surviving a far longer time. And when you have people living longer, just as if you're old, as a young person and you age, your body starts to deteriorate. There are things that you see that are age-related changes because you live longer. And as cancer survivors, we started to see late and long-term side effects of cancer treatment. Lymphedema was one of those. So that quest to try and control and treat the lymphedema sent me on a lymphedema certification course. So for 2 weeks, I went over to the United States and I did a certification in lymphedema therapy. It was not easy. It was rough. 2 weeks. I remember that. That was the year Fantasia won American Idol. I think that's the only thing that pulled me through. But I did that certification and I came home and I was just blown away by the results that we got. Because once you have the right education, you can get the right results. And I've always been an advocate of education. And so as I began to treat lymphedema patients and we began to see the effects, I got more and more lymphedema patients. And these lymphedema patients were 9 chances out of 10 cancer patients. So not only was I seeing lymphedema, but I started to see the other things that happened as a result of cancer treatment. So as a result of surgeries, we got scar tissue and pain and stiffness. Out of chemotherapy, we got weakness and chemotherapy-induced peripheral neuropathy. We got balance disorders. We got digestion disorders. Out of radiation, we got burns, we got stiffness. Out of hormone therapy, we got joint pains. And so these patients would come with a swollen limb, but more and more other complaints. And then I had to get myself together. And like, I had to learn how to treat those things as well. So I found myself constantly going back and learning and trying to gain knowledge to make sure that I can meet the needs of these patients when they presented. So that is how I really got fortified in this field of breast cancer rehab and oncology rehab. And I've never regretted a moment of it. And so that brings me here today. So the cancer, she says, well, I want you to talk about the role of physical therapy in cancer management. So I'm not the regular physical therapist, and that's not to say that I'm better than the other physical therapist or I'm worse than the other physical therapist. I'm just a little different in my approach as well, because I consider myself an integrative and holistic approach therapist. I'm also a holistic health coach. So when I approach my patients, I'm not just looking at the physical aspect of it, the swollen arm, the stiffness, the neuropathy, the numbness, the tingling. No, I'm looking at the comprehensive holistic patient. What else are you dealing with? Because if I can't meet you on what we call the bio, the psycho, and the social method, then I'm just working in vain, because I have to address everything. And so I've been known as the therapist that talks too much or touches too much, but most of my patients do very well, and I'm happy to be that therapist. And if I have to wear the weird cap, I'm happy to do that. So you will see me talk about things that probably won't fall underneath the direct realm of physical therapy, and that's okay, because you're talking to a different physio. Please feel free to ask questions, because I'm here to meet your needs. I hate just talking. I'm very integrative. I like to be very involved. I need to make sure that the time that I spend with you, you should be able to leave with nuggets of information that you can apply tonight, okay? So let's talk about the role of physio. And I'll talk about my role as a physical therapist, the role that I've created, the niche that I've created, the space that I feel safe, and the space that I feel that I'm serving the best in. Like I mentioned, I've been doing this from 2004, and there have been moments where I've stepped away from it. So I've stopped practicing as a breast cancer specialist or oncology specialist for probably about 2 years at one time, a year at another time. And because sometimes I do get compassion fatigue and I get compassion burnout. With my child, and I lost 3 patients in 1 week. It was absolutely devastating. And one of the things that I realized is that you have to have support. And so not only am I treating my patients physically from a medical standpoint, but I need to make sure that I support them on, again, like I said, on the psychosocial and mental wellness. I didn't have anybody to support me at that level. And the best thing I could do was just remove myself from it for a little bit and catch myself. And I think I swore I'd never come back to it, but I was so disappointed in the kind of care that cancer patients were getting that I got frustrated. And I was like, well, somebody got to do this. So I rolled up my sleeves and I got back in. And the reason why I say that is because I don't know if you as a cancer survivor has ever been told when you complain about something, oh, well, that's just a side effect of cancer. Or, you know, don't worry about that, you survived the cancer. Or, you know, the tumor is gone, or you're in remission, so don't worry about it. And to me, that's not fair. That is not fair, because our goal is to make sure that we maximize your health, we maximize your quality of life. And that is what I am truly, truly passionate about. So as working as a clinician treating, I decided I need to make a dent in it. So my dent, I decided to make the dent in becoming a breast cancer advocate. So to people about sort of hard in this climate, in this environment with our genetics, but the fact of the matter is that somebody has, and I figured if I could start talking more about education and prevention, then I would be so patients to make money, but I can have, and if I deter people or prevent people from being detected in later stage when the chances going to be less, then let it. So I hit the pavement with the bomb drivers because she was doing such a great job with that. But this is where I got as an educator treating breast cancer patients. I'm also educating that may be at risk of cancer, talking to them about the risk factors, what to do, what to prevent, how to prevent, and how to monitor, who to talk to, what questions to ask. And so that's one of my roles as a physical therapist. My role is to educate, to promote, to screen, and just to be there. Yes, Ms. Paula, it's a lot. I try. So I try to do my job in terms of bringing that level of compassion, because somebody needs to be your voice. Not all the time you're going to be able to speak, or you don't even know what words to say. And I want to be that person to bridge the gap and to say, this is what you need to do and this is what you need to say. We might I'm trying to choose my words because we're being recorded. We might irritate some people, but the fact of the matter is that you have a right to good health. You have a right to good wellness. And that's what we're going to do. We're going to advocate for that. We're going to educate for that, right? I have some peeves I won't get into. We'll probably talk about it off air because we need some focus for the next year. And yeah, the truth is the truth, but the truth hurts. And sometimes they can come back and get you in the butt, though, so we'll work on that. So that's what I do. I educate, and I educate, like I said, to prevent, but I also educate the survivors. Remember now, survivorship begins the diagnosis. And what I'm trying to do is promote myself as an educator from the minute you're diagnosed. And like, so what can I do? What do you do, Kitty, as once I'm diagnosed? You can't do anything for me. They just told me you have cancer. What are you going to do? Well, the fact of the matter is that once you're diagnosed, you need to know that you have support, and you need to know where your resources are. The most painful thing for me is to see a patient 2, 3, 4, 5 years later, and they're dealing with something, and I hear from them, well, I didn't know you were here. I didn't know I could do anything about this lymphedema. I just thought this scar tissue was just because of that. I didn't know my breast had to look like this. And I'm like, look, we are here. This is what I do. I take care of these things. I look for all of the issues. We try to fix them as soon as possible so they don't become issues. And then what I also do is I educate you as a survivor. What are the expectations? What are you going to expect coming out of surgery? You know, how many patients have gone into surgery and didn't realize exactly what it was going to mean to come back out with one breast, right? And the horror and the hurt of some of these women not being told what shirt to wear, how high to raise their arm, what and what not to do. And I feel like we've dropped the ball, and I take responsibility for that. I can't reach everyone, but if I can start speaking and letting the physicians know, and letting the nurses know, and letting you, because you're now ambassadors for breast cancer, you get it by default. That's your title by default. You now know that there is somebody that you can send people to just have a conversation with, to say, look, if you're going for surgery, we're going to expect X, Y, and Z. Okay, if you're going to do chemo comes to force time, maybe numbness and maybe tingling. Do you know that if you exercise during chemotherapy, that the effects are so much better, that you don't get as nauseous, you don't lose as much weight, you don't get as weak? And Ms. Sheila, I'm sorry, I know what that is, that gross body dysmorphia where you wake up and your breast is gone, you don't know how to touch it. I can tell you one time I had a couple that came in, and the husband or the boyfriend was so supportive, you know, and he sat there with her and everything. And I remember after I spoke with her and I took the shirt, I asked her to take her shirt off because I needed to see what the scar tissue looked like. Because when I'm looking at your scar, I'm looking to see how well it moves. Because believe it or not, that affects your breathing. That affects your posture. So if you have a tight scar that's pulling you forward, you can end up with neck pain, headaches, jaw pain, right? You can end up with shortness of breath because your chest can't fully expand. You can end up with pains in your lower back. And this is what I'm looking at when I look at scars. But I remember removing her shirt, and the boyfriend just panicked because he had not seen the incision site. She had had the surgery almost 2 weeks, and she had not allowed him to see it, and it was devastating for him. And his reaction caused her to cry. And I was like, I was not prepared for this. But I'll tell you how we got through that. You know, I had to tell him that, you know, it's okay. She's had this for 2 weeks, and it's okay. And, you know, I believe the breast is still there. That's how I treat the breast. Like the breast, if you take 1 or 2, they are still there because you've had these breasts for all your life. That is imprinted in your brain. So I teach people how to touch themselves like the breast is still there. And that's what I did. I taught him how to touch her like the breast is still there. And the amount of comfort that brought to her. Now, it may not work the same for everybody because people do it at different times, but at least that was something that I could help both of them heal through that process of dealing with the surgery, okay? There are other techniques that we use, but these are things that people don't talk about, because who talks about that, right? Nobody's going to talk about waking up and looking at my scar, still looking at my scar. Am I loving my chest? Do I feel like a whole woman anymore after my breast is being removed? These are the conversations that I try and encourage as I see patients in the clinic. Thank you so much, Ms. Paul. I'm trying. So as we talk about chemotherapy, like I said, things to look out. If you start feeling that numbness and tingling, let's jump on that right away. The things we can do, we can start massaging. There are exercises that we can do. We do laser therapy. We talk you through it. We don't want you to sit there panicking, thinking that your body is rebelling against you, because that's never our intent and purpose. We always want to make sure that you know that we can help you get through this. For radiation, we talk about range of motion. Now, here's a surprising thing a lot of patients don't realize with radiation, especially for women. Once we hit about 35, a lot of us start to have shoulder problems for whatever reason, overwork, lack of use, previous injuries, right? Right? And so if you're a patient and you have a shoulder injury, right? You had stiffness or pain, I have pain because I just don't. I need to do better self-care at the end of the day. But if you had to do radiation on your chest field, let me see if I can bring my camera down just a little bit, and just say my radiation field is here. So I need to get my arm out of that. If I have shoulder pain, I can't take my arm out of the way, right? So sometimes as a physio, I have to come in there and I have to help you get that range back and to decrease the pain so we can get the arm out of the way, because we don't need the whole arm radiated. We only want that radiation on that specific spot, because we know the collateral damage of radiation, which is burns, as well as what we call radiation fibrosis, which is the tightness of the skin and tissue. Something else as medical professionals we don't talk to the patient about, because yes, you will get tight after radiation, but do you know 7 years after is when the radiation fibrosis really, really kicks in and can be a real hindrance to you. So that's what I'm saying. We sometimes didn't have cancer survivors living 7 years post-radiation. So we didn't know that. Yes, 7 years later. So now we're seeing this increase, and now we have patients panicking, and we're like, don't panic. Don't panic. Let's do a diagnostic. Let's make sure there's nothing else going on. But we expect to see radiation fibrosis 7 years, because that's just a part of what happens. So here's where I come in and say, make sure you keep your stretches up, because if you make stretching every day a part of your routine, when you start to shift, then you get to understand that, look, something's happening. Maybe I need to do a little bit more. And then you know who to call, who to go to, and we can give you some things to do to make sure that that radiation does not hinder you. All right, so we talk about the other drugs, the hormone replacement therapy, wear changes, hot flashes, menopause. One of the things that I started doing with some of my patients is spiritual baths, right? I told you I'm a little off, not off, I'm off the track. So what it is that sometimes when you start your hormone replacement therapy, you lose your periods, right? As women, you don't see your menstruation anymore. And for some women, they're not prepared for it. They know it's a little devastating. But one of the most beautiful things about being who we are and being a part of nature is that everything's a cycle. So, your period cycle is like 28 days. What I try to do is I try and get my women on a cycle. So even if you don't see your period, then let's line up with the moon. I always, for those who follow me on Facebook, I'm the moon kid. I follow the moon. I just love it, because I tell my own children, this world is constantly changing. We've seen 2020 divvy up toss salad every other week, right? But what's constant is that I know in 28 days that moon is going to rise. So sometimes you need things to send to you. So I have my women time themselves with the moon. So you love your body. You go through the cycle of the moon. So even though you're not seeing your period anymore, you love yourself. You track your body through those 28 days. You honor yourself every 28 days. So if it's one day out of the month that you're going to honor yourself, is the full moon or the new moon. You can pick any day in the cycle, but just doing that gives you something to tie in so you don't feel so lost and discoordinated, because all of a sudden you don't have a period. And as much as we don't like them, we've centered our lives around them, believe it or not. And even for women who've had hysterectomies, that happens. And if you're enjoying your menopause, fantastic. But there are some women, especially the younger women, because remember in the Bahamas now, we get cancers very early in our 30s. And sometimes losing that creates an additional stress, but giving them something to be centered and balanced on sort of helps them move through that. So that's the treatment part of it. And if you have questions about any complications or symptoms that you see, I'll be happy to answer them. And so there we go. Our divine masculine man is even getting into the moon. I believe in it. we are nature. We've disassociated ourselves from nature, but we are nature. The more in tune we are to nature, trust me, the better balance that we will be, and the better able we'll be able to handle all of the extra changes around us that sometimes don't matter because we can't control them. We control how we balance ourselves and we stay grounded and stay in tune. Okay, so I'm here to educate. I find the resources. If I don't have the questions, I go and ask. I'm a part of the American Physical Therapy Association. We have an oncology section, Academy of Oncology. I call myself the run to the litter. Most of my girlfriends have been in this game 30, 40 years. They're professors, they're researchers, and I have a phone a friend method. I WhatsApp, I phone a friend, I Facebook. So if I ever see a patient that I'm severely challenged with, I pick up the phone right away, and I have a slew of physical therapists that are just waiting to just tell me how smart they are. And I'm just like, give it to me because we need it. So, you know, when I first started this, I felt a bit incompetent because cancer was so vast, and I won't begin to tell you that I know everything about it because it's just so vast, right? The diversities of the different types of breast cancer, the diversities of treatment. But the fact is knowing that you have resources that you can contact and get that information from, that is one of the roles that I serve as well. I always say you don't know what you don't know till you realize you didn't know that you didn't know it. So make sure you ask those questions. So we talk about prehabilitation, that's what I said from first diagnosis. We talk about treatment, and then we talk about post-treatment, or what we call prospective surveillance. So what prospective surveillance is that after you've finished your cancer treatment and you've been diagnosed or deemed in remission, what happens is that we set time frames. Initially, after the first year, it's every 3 months where we bring you in and we just do measurements. We're measuring your arms or your body parts for lymphedema. We're measuring your range of motion. We're measuring your breathing during that year for every 3 months. Every 3 months. Sometimes we do twice for 2 years. The third year, we usually go to every 6 months. And the fourth year, I think, is every 6 months. The fifth year, we go back to a year. And the reason why we do that is because studies have shown that reoccurrences happen usually within the first 3 to 5 years. And if we're paying careful attention to you, if things start to change, I'm like, hey, something's going on here. Let's get this investigated. And we're able to pick up things faster. Remember, the earlier in the stage that we detect the cancer presentation, the better able, or the better the response for the treatment, and the more likely you are to survive with good quality of life, right? The less things we have to cut out, radiate, chemo. So we want early detection, and this is what prospective surveillance is. And it also allows you to have that touch point to know that you have somebody that's looking for you and waiting for you every 3 months to get this thing together. And so if anything happens, you don't have to run down to doctors, you don't have to run down the oncology nurse. You know that your physio is there. I'm here for you, and we can follow you and watch how things are progressing. So that's prospective surveillance. The other thing is to become an advocate, right? So we're advocating now that stop charging us for mastectomy bras. That's stupid, right? Why you give me the mastectomy bra free. I only get one free, and then I have to pay for the prosthesis. But I think they're giving us the prosthesis free, and I'm talking about bringing it into customs. But why are we paying for these things? Like, why are we putting taxes on things that are medical necessities for some people, right? Advocating for decreasing cost, advocating for decreasing cost on products, just advocating that we have better healthcare, that we have better access to care. I know oncology is inundated right now. They always seem to be overflowing. My patients at CPMH oncology always have a story, and I'm so sorry that that's the case. And it's even been more stress this year because of the lack of access due to the shutdown due to COVID-19. And so, you know, how do we get more oncologists here? How do we get more oncology trained nurses and physios here, right? And the thing is, as a private PT, I have bills I have to pay as well. So I know sometimes that when I say my price, it can be costly, but what we try and do is advocate for people to donate. So we have like scholarships for some patients who can't afford it, or we'll give one session free. Yeah, but it's really hard because the cost of doing business is so high in the country. And we need to advocate for changes in certain things, because if we can get our costs lowered down, then we can give the services at a cheaper cost. And so this is where the advocacy comes in terms of having these conversations. And so that is how I see my role as a physical therapist in oncology and in breast cancer management. I don't know if you have questions for me. I'm happy to answer all of the questions. I see 49 chats in here, messages in here. Hold on, let me go back and see. But please feel free
That's a lot of
to ask me questions. Pardon?
That's a lot of praise for you.
Okay. I just didn't want to miss any.
Okay, I have a question to start our questions.
Yes, ma'am.
Once a cancer patient is diagnosed with breast cancer, and I don't know that, I don't think that you only treat breast cancer, but once a patient is diagnosed with cancer, what advice would you give them as it relates to the timeline that they should see a physiotherapist? Are you recommending that it's post-surgery, pre-surgery? Where do you see the greatest results?
So I can't say the greatest results because I haven't done the research to have the empirical evidence. But to answer your question, the minute that you are diagnosed and the minute that you are doled out a plan of care, so not all, like I said, not all patients go straight to surgery. You have what we call neoadjuvant chemotherapy, which is administered before surgery with the hopes that we can reduce the cancer or the tumor and before we do any further intervention. So the minute you know that you're going to start treatment is when you should reach out, because then we can discuss what the treatment side effects and expectations are, and we can have you better able and prepared to go ahead and face this. Okay. So that would be my answer. The minute you get your plan of care, the minute you get your diagnosis, because sometimes just having somebody to talk to that can give you a broader perspective would be helpful.
Okay, thank you. Does anyone else have questions for Dr. Kitty? If you do, go ahead and unmute yourself, or if you don't want to unmute, type your question in chat, please.
Good evening, Dr. Kitty. Mary Wilson here.
Hello. Hi, darling.
Yeah. How you doing? Listening to you just now, I think more public education needs to be had. Thinking of myself before my diagnosis, after I was diagnosed, I really didn't know what questions to ask. Until now, I am still learning, even after I would have had surgery.
Okay. You know what's interesting about this? Perhaps what we should do is let's write down the questions that you wanted to ask or the things that you wish you had known, and then we can put together a presentation and just have it there. So I'll tell you what I'm working on right now. I am actually working on, well, we have it already. It's called Roll With It, Breast Cancer Rehabilitation Program. And what it is going to be a 6 weeks program for you to take at your own leisure, a course that you can take at your, I don't want to say course, but it's a program to take at your own leisure where we're trying to fill in the gaps. So we're going to talk about what breast cancer survivors need to be aware of in terms of what to expect from the treatments that they've had and what to expect as a survivor. But also it's going to give you some support in terms of nutrition, very light nutrition. When I say light because when we give nutrition prescriptions, it needs to be very individualized because nobody is the same. I don't care if you had the same type of cancer. Your nutritional needs are going to be different, right? If you had the same type of cancer and somebody's pre-diabetic and the other person's not diabetic, or some person's hypertensive and it's not hypertensive, there needs to be something that's done individual. But for the most part, there are certain things that we can talk about in terms of, and we've done that. So I have Dr. Ann Roll, who's a holistic nutritionist. She's put something together for us that we can have in that program. And so we're getting ready to launch it, if not in October, maybe in November. And so if I have your questions, then I can better answer those questions and put them in there and meet the needs. So I'd really appreciate it. I mean, and please no question is dumb, no question is silly, no question is naive, because like I said, you don't know what you don't know until you ask about it. There are times when I do these presentations and a patient asks me a question, I'm like, "Ooh, I didn't know that. Let me look that up." Or I think, and I'm not ashamed to say that I don't know it, because things happen so quickly. Research is happening so quickly. And then also the access to information in terms of the internet, that there are a lot of people putting out information there, and it's not that the information is wrong. It may not be verified. And then you also have to understand too is that if it is coming from a source that is a retailer or a merchandiser, things may be tainted or persuaded in a particular way to sell the product, but may not be sound medical information. So I love those kinds of the conversations. And so we can have that there. Okay. I'm seeing Ms. Sheila saying, I wish I knew of the other treatments, options, and the values of a second opinion. And I totally agree with you. Some of my frustrations, I can tell you that I've seen for breast cancer survivors that I think it's not fair is I don't think you're given enough time to make a decision. And the reason why I say that, because many times when the diagnosis is given, usually the women aren't ill, right? Women aren't ill. You don't feel ill. And all of a sudden you're like, oh my God, you have cancer, and it comes to you like that. And you don't have a minute to say, hold on, time out, let me take a breath, right? Now, truthfully, sometimes we do catch people in late stages, and maybe we feel we need that rush. But when you're rushed and you don't get a chance to make decisions that have been considered and other options, I find that a bit unfair to the patient, because a part of accepting your diagnosis is being given the time to digest it and questions. And they're not given that. They're like just given this checklist of things that they have to go and do. One of the things that I see that and I'll say it, I'm annoyed with is if we have a patient that has been diagnosed with breast cancer, and depending on their presentation, this patient might need chemotherapy, radiation, and surgery. They do the chemo, then they're going to do the surgery, and they're like, well, I don't want to look like I lost my breast, so I want implants right away. And they go and get implants, but then they have to get radiation, and you're going to radiate the implant. So it's like that's not the best option, because we have lots of complications of radiated implants, and it's almost like doing plastic surgery on a part that you're going to manipulate again. You know, those are some of the decisions that I don't think were thought through before somebody does it. And I'm going to say it, you know, when you work in medicine, you make money by treating patients. So if I have to sell a service, I'm going to sell a service, but sometimes I'm not going to arm my patient with the best information, because once I get my money, it's done and done, you know, and then, you know, it's a complication of the surgery, or it's a complication of radiation. So I wish that if you speak to somebody who's diagnosed with cancer, you tell them slow down and ask the questions, and make sure that that you look at the options, and, you know, ask for a second opinion. If you don't like what I say, go Google it someplace else, go find another therapist and talk about it. If I'm wrong, tell me I'm wrong. Let me get my A game up. Let me get educated. If I'm right, then you're even more reassured. And I don't even want to say right. If we share the same opinion, because you could have two wrong opinions too, right? So, you know, you feel a little bit more assured. But having the option and the opportunity to ask questions and to have second opinions empowers you, because at least you feel like you're in control. It's your body that all of this is happening to, and it's your money that you're spending, and at the end of it, you have to live with it. And you can get mad at the therapist, you can get mad at the doctors, but the thing is, you don't want to be mad at yourself for not giving yourself the time. And the physician may get mad and say, well, you wasted my time, or you delaying this thing. Well, you know, if I didn't find it until next week, then I would have had an extra week. That's how you have to do. And I can't begin to know what it feels like, because I've not had cancer, but I've sat beside people and I've held their hands and I've listened to the stories enough to know what it sort of feels like. And if it ever happens to me, I want to be able to say, hold on, time out, let me process this. Let's get a second or third opinion. and let's move on from there. So yes, Ms. Sheila, I'm sorry that it happened to you, but now you're an ambassador for this. And if somebody else comes up to you, that's probably one of the things that you could talk to them and say that. And sometimes we need to humble ourselves as medical professionals. We don't know everything, you know. I know my body better than anybody else. You might know your medicine, but I know my body. And let's have that talk, right? So, yeah.
Are there any other questions for Dr. Kitty? Guys, if you're uncomfortable asking, private message me, and I will send the questions to Dr. Kitty so that she can compile the information booklet. But if anyone else has a question now, please unmute yourself and just ask.
Yeah, Judy is saying that the doctors get offended. So what?
It's true. Go ahead,
So,
Deanne.
so what? You aren't you offended?
Yes.
And you paying the bill? So what? Let them know that you're not a run over. Let them know that you won't drink every soup you put in front of them. You know, at least when you make your decision now that you're sure, like I said, that you're standing assured that you've done your due diligence, right?
Okay. Hello, Dr. Kitty.
Hi.
This is Deanne. How you doing?
I'm well, thank you.
Good. My question is, okay, I'm a left breast. I had a left breast mastectomy, right? And I had 16 lymph nodes removed. Okay, now as of late, I'm a 13-year breast cancer survivor. I'm realizing that if I use my arms a lot, my left hand, like there's a swelling, you know, in my back and underneath my arm. I want to know if is that normal to happen?
So I don't like to use the word normal. So it's not normal. It's an abnormal swelling in the area. Now, is it an expected side effect or expected late or long-term side effect?
Wrong?
Yes, it is.
No.
Okay.
You're asking me that question?
Yes, I know. I'm telling you that it's not normal because you shouldn't. We don't want you swelling, but we expect that to happen.
No.
After you've had surgery and after you've had radiation in a particular area.
No. Wrong.
Okay, I just had no radiation. I just had chemotherapy.
Right, but you've had
like
surgery.
Yeah, I had surgery
and you've had the lymph nodes removed, right?
Yes. Yes.
Okay.
Yes, and it's on the left side. Like now, just that as of late, it started, you know, like it'll pain me a lot, and then it's the fluid. You know, I normally try to massage it or have my husband massage it, you know, and all that sort of stuff to push the fluids out and all that sort of stuff.
Right.
Like that.
Right.
So what would you suggest like that? Should I come and see you or see a physiotherapist or massage therapist to do something like that?
So, okay, so I'm glad you asked this because I didn't address this. I'm very territorial over my patients who have been diagnosed with cancer. Very territorial.
Okay.
And I'll tell you why. Because there are a lot of people who are well-meaning that treat these patients and do not do a very good job. In fact, they exacerbate or worsen the situation. I've had a physiotherapist worsen a patient because it wasn't under their realm. They didn't know what they were doing. And they worsened the patient. They put a hot pack on a patient that had been radiated and they caused the swelling to be worse to the patient's head. And I was livid because one, you may be a physio, but it's not your scope of practice. I don't treat pediatrics, right? Because I haven't gone into the depths to take care of babies to call myself a pediatric therapist. When you have somebody that's skilled and trained and you know that, send them to that person. Like I said, we all need to make money, but not at the risk of my patient. We also have some massage therapists that do what they call lymphedema drainage. That's not what you have. You have the lymphedema, or they call it lymphatic drainage. Lymphatic drainage is a very superficial, a very light treatment. Lymphatic drainage, what cancer survivors deal with is because there is an impaired lymphatic system. And so your intervention is different. You need to understand what impaired the system, meaning the surgery, meaning the radiation. You need to understand where is the healthy or the unhealthy, where the block is, where the block is not, and that's how we treat. So the short answer to your question is you need to see a physical therapist that is trained in cancer management. And you should be able to call us and ask us to see our certification. All right. And if we get offended, then we're not the physical therapist for you. If you go on my website, or my Facebook page, I post my certification so you could see. You could scroll through. Actually, maybe that's what I need to do. I need to put them all in one area so you can see what my training has been. Because far too long, I've been seeing patients getting hurt from healthcare professionals. So now for your presentation, yes, I would say go to a doctor, your physician, let them see what's going on, because we need it documented medically, and ask them for a referral. Now, somebody said earlier on that they didn't get, the doctors don't like the referral. Well, then that's not the physician you need to be going to. Because if your physician is limiting you to care, that is not somebody that has your best interests at heart. All right. It's one thing to get a referral and do not go, but to be denied a referral, why would they deny you a referral? Why? What is the rationality of them denying you a referral? So if you're working with a physician that is not going to give you a referral, then you need to change your physician. Okay, so get a referral form. Let's do an assessment. Let's figure it out. I love the fact that your husband's doing the massages. You could bring him in. He can watch our treatment protocols. He can go home and take care of you. You probably need compression garments as well. Okay, because like I said, we didn't understand what was going to happen to the body with cancer because people weren't living that long. That was the fact. People used to die 5 years after being diagnosed if they lived that long, because we caught it so late. And then our treatments weren't that good. But now we have people that are 15, 20, 30-year survivors. And like now we're seeing the late and long-term side effects. So sometimes we put on more weight. Our cardiovascular system is not as effective. So then we tend to see lymphedema presentations going on. And that's probably what's happening with you. So the best way to do that is, number one, decrease the lymphedema in the area, redirect the flow, teach you how to do it, and then keep compression on, because lymphedema cannot be cured. It can be managed. And we manage it by compression, manual lymphatic drainage, exercise, and good education.
Okay. Gotcha.
Okay.
Thank you. Thank you.
My pleasure.
Dr. Kitty.
Go ahead.
Yes, ma'am.
I have my situation is similar to Deanne's, and I am so glad you said something that I wasn't even aware of. The longer I've been a survivor, I'm noticing that I tend to have more of a fluid buildup. But with me, what I do is I walk 3 to 4 times a week, and while I'm walking, I use a squeeze ball in my right hand, and I find, Dr. Kitty, if I don't do that for 4 days, I can't lift my hand.
Okay.
And if I go longer than a week, I feel like Deanne said, you would feel and see the swelling under your arm or at the back. So for me, I have to exercise for the rest of my life, because the minute I don't exercise and do what I have to do, that's what happens.
I didn't get your name. What's your name for me, please?
Judy Miller.
Okay, Miss Judy. So Miss Judy, you're smart. You figured it out, but everybody's supposed to be exercising for the rest of their lives.
I'm telling
you, if you don't do it, it shows up right away. So you're doing all the right things. And perhaps there's some other exercises that you can do to help you with this. So here's what I will do. For anybody who is on the call right now, if you can send me a quick email. Let me see if I can put my email in here. Send me an email at Handling Your Health. What we'll do is we'll give you a free assessment. Okay?
Okay.
For the month of October, we'll give you a free assessment at live.com. Handling Your Health at live.com. And that free assessment, we'll look at swelling in the area, we'll look at range of motion, and we'll do a basic endurance. And so we could set some goals for ourselves, making sure that we pay attention to it. And the fact that you are such a great supportive group here, you can have a great buddy system, and then we can keep coming back. This is not the first time I presented to your group. I have no problems coming back and presenting to the group, but we need to take responsibility. We need to take ownership of our health. You know, my good friend Melissa Major always talks about being your own health advocate, and it's so important, because nobody's going to give you all the answers. And, you know, they have other things to worry about a lot of times, so you have to keep beating the drum. And this is why I talk about advocacy. You look at each other, you see each other, you see yourselves in each other, and you have to make sure that you are your brother and sister's keeper. So if you see something, girl, why your hand look like that? Why are you dragging this? Why your head forward? Why are you humped over? These are the things that you should be looking at each other. You should be able to be looking at posture. You should be able to be looking at where we're breathing, those kinds of things. You see, for me, I'm going to use the word struggle. I struggle as the clinician because I can tell you I do not get a lot of support from the physicians, right? I have physicians that send patients to me dragging an oxygen tank and a mask. And I like,
Wow.
so why you send a patient here to me? Oh, make her comfortable. I'm like, what? No, like seriously, like make her comfortable. So what that is, well, the patient probably have like a week and a half to live. So what I need you to do is just try and make her comfortable until she dies. I'm like, do it, like seriously. Like when you realize all of this was happening, could you not send a patient when you started to see swelling? You know what it is to get a patient from a physician and this woman been swollen for 3 years, always watching it to see if it'll go away. I'm like, seriously? Like you didn't watch the tumor to see if the tumor would go away. And so I struggle in putting things together and keeping the information out there and meeting the needs of people. And I try to do these presentations a lot because I want you to know that we're here. But it is frustrating. And like I said, even though I'm a breast cancer specialist, that's not where the bulk of my money comes from, unfortunately. I'm fantastic with feet. I could treat a foot. I'm also a diabetic educator, so I take care of people with diabetes, right? I love shoulders, I love hands, so I treat all these other people. But the population that I really want to serve is the hardest for me to get at most times because, like you say, the doctors don't refer. What I need for breast cancer survivors to do is advocate and say, look, I need to see this. I need to get this done. If we have more and more people doing this, then, you know, we can have these services more out there, more available. We need to start poking them and prodding them a little bit more. I will take responsibility that I need to do more on my end, but you're the consumer, you're the patient, you're walking this walk every day. And if you don't say what your needs are, they won't be met. And I know many times, you know, people make you feel that, oh, you survived cancer, so what you complaining about? What's a little swelling? What's a little stiffness? Your feet numb, that's okay, that's what is happening with chemotherapy. No, we can improve all of that. We can improve all of that. And this is what my role is as a physical therapist is, to talk about it. So I try my best. I'm not as diplomatic as I should be. I'm working on that. Maybe DeCassa could help me smooth out my rough edges. Because when I start talking and my eyes open up wide and I cock my head to the side, I'm like, you know, and I have to remember my mom's like, Kitty, your face shows everything. Okay. I'm like, okay, Jesus, I need you to be a placid face. But, you know, after dealing with it so long and seeing these things and hearing these stories, I'm like, why are we still doing this? Why are we still having women dealing with these issues? You know, but it's a multi-pronged approach. We need the physicians more engaged. We need the patients to advocate more. And I need to keep making all this noise, you know, and this is what we have to do. And we can't just wait for October. I personally don't wear pink. If you all see me in a pink shirt, I really, really like you because I'm a tomboy for life. But I would put on pink only because of breast cancer survivors. No, I detest pink. My dad tried to girlify me, so that's my rebellious nature. I love blues. And then God gave me 3 girls to say, hey, I gotta make sure you stay girly. But we can't wait for October just to pink it out. We have to make this conversation constantly because cancer doesn't go away in November and come back again in October, yeah? So you guys have to be the advocate. You are the ambassadors. You need to ask for what you want. You need to ask for what you need. You need to educate the young ones that are coming up. And when I say young ones, I don't mean young in terms of age, but the newest survivors, the ones that are going to begin to walk this walk. Yeah, Miss Paul, I'm the worst tomboy, I ain't gonna lie. I'm not gonna lie, and I'm proud of it. I'm proud of it. But please know that I'm here for you. We're trying to recruit some new physios to become more involved with oncology management. One of my colleagues said to me when I first started this, she's like, well, why you want to deal with cancer people? They about to dead anyway. I'm like, but we all about to die.
That's right.
My mother-in-law says it's not the sickest that goes the quickest. How much people you know with cancer still here? A lot of people trip out this year in 2020. Like how many unexpected deaths that we have? So a lot of therapists don't like this because of the emotional commitment. I think some of us, we are chosen. We didn't choose it. It chose us. And I truly feel that way. I lost 3 friends at the age of 33. We were all 33, and both of them died from breast cancer. One left 4 children, one left 3. that touched me. I can't walk away from women serving, going through that walk. I can't do that, you know. My mother-in-law has had breast cancer. I have two children that may be predisposed to breast cancer. I wouldn't want somebody not to treat my child because they wouldn't want to walk the walk of losing a patient. We all have to cross over, but I want to make sure that at least the quality of life until we cross over is going to be pretty good. And this is what fuels me. This is what fuels me. You and seeing the tenacity. Gandhi's was on this earlier, and I mean Gandhi's had it all out in the road. I'm just like, girl, if that is not inspiration, what is? You know, and Miss Sheila and Miss Paula and Miss Mary that I've been, you know, blessed enough to interact with and take care of. You know, thank you for the opportunity, and thank you for trusting me to help you along your way. You know, at some point in the journey, there's a lot of work to be done, and it doesn't all have to be mucky and trudging. I mean, you guys know it. You'll have a fantastic time. The energy is awesome. And I told the Cass I could talk all night. She didn't believe me, but I am going to hold up my own red card and say thank you very much for the opportunity to present. You can reach me. We're going to open it up. I think maybe the first 15 people that contact us for the month of October, we will give you the free assessment. So please reach out to us quickly so you meet that first 15, and you know, share what we have. Share what we have. Visit our Facebook page. I've been a little slow this month. It's been a really rough month for me, so y'all hold space for me. But I'm going to try and go out there, and you might see more stuff from me from out of October. I do have a presentation at the end of October with the National Lymphedema Network. I have two presentations, one talking about edema of the breast and the other one talking about holistic approach to lymphedema. And if you're interested, I will post the link on our Facebook page. Please like and visit our Facebook page. Feel free to ask the questions. And it has been my absolute pleasure to share with you tonight.
Well, Dr. Kitty, thank you so very much. We are grateful.
The question before Doc go, since we are her patients already, do we get a free candy?
Yes. Go right to your cupboard, take it out, and enjoy it tonight. You have a free pack from me.
No candy.
Kitty, thank you so very much. I know that you're still in your office. You need to get home safely. You've had a long day, but we really appreciate you sharing this information. I've had survivors messaging me on my phone talking about they need this recording because it was kind of breaking up for them on their connection and the valuable information. Ladies, type in chat the value you got from this session so Dr. Kitty could at least see the value you got before she tips off of the call and we continue on with the meeting. But Dr. Kitty, thank you for the work that you do. Thank you for your advocacy. Thank you for your love and your passion to support your patients, regardless of where they came from. But for right now, for cancer patients, I want to specifically thank you for your dedication to advocating for us. So we need people like you. We need people like you to educate us, people who aren't afraid of let me turn the recording off.